Welcome, everybody, to our next edition of Hearing Health Highlights. And today I have Carlett here, who is a member of the Independent Connected Audiology Network. Welcome, Carlett, and tell me a little bit about yourself and your practice.
Hi, Cora. Thank you so much for having me. It's great to be here. A little bit about myself. Like you said, my name's Carlett. I respond to almost any name at this point. To be honest, people call me all kinds of things, just because it's a difficult name to remember sometimes. But my practice is situated in Pretoria East in Gauteng. And we're an independent practice, as you've mentioned. I'm an audiologist that's been in private practice now for 3 years. And before that, I used to work for one of the lead manufacturers in the country. And audiology has just kind of been such a big part of the last, I would say, 8 years of my life that it's really exciting to feel like we are making headway and actually growing in a positive and good direction.
That's awesome. Hello, Melanie. How are you?
Hi, finding you.
Thank you. Thanks for joining.
I think it's always difficult to run a private practice. There's all these challenges going on behind the scenes that you don't really prepare yourself for. But what is it that you are enjoying the most about being a private practice owner in our context?
That's a good question, because I think many people might have different answers to this. I think what I found most rewarding and enjoyable is, I think audiology is a passion, yes, but what really makes me tick is helping people reach their potential. So in whatever way that might happen. And it's been so rewarding to see in every, I think you guys might know, it's a daily occurrence where you see people walking into a sphere of their life that they previously weren't able to thrive in. And all of a sudden, they're enabled, starting to connect in a different way. So that's been, to me, the funnest and best part of it. Everything has the flip side, the good, the bad, and the ugly. But I would also encourage my patients to kind of share both sides of the coin as well, to help us, gauge things a little bit and have a realistic view of their experience.
It's so nice listening to everyone else's plights and challenges and successes. And I find that one really important thing that other people take notice of is other people. So people like to hear about stories from other people that maybe have the same challenges that they do, and this might resonate with someone that's watching. So I wanted to ask you if you can remember anything in the back of your mind, a really positive story, heartwarming story of something that happened in your practice that might be an educational learning curve for someone else.
Yes, so that's something that also luckily happens often, so it's not too difficult, but it's hard to sometimes choose and single out an experience that really sort of stuck out to me personally. But if I had to, one of my recent clients is a young lady. She is about 29 years old, and we started with hearing aids. She's known that she had this hearing loss for a long time, but she hadn't really stepped into the world of treating it yet. So we started that journey together and tried to see how we can assist her. And just seeing her over the last 2 years, each time she's come back into the office, she's explained how she's able to connect at the kids' church that she serves in again, how she's able to become a role model to other kids that might have disabilities, or the way she reconnected with her husband. And in saying that, we had a husband for a few sessions with us, and enabling him and giving him a toolkit to understand how to communicate with her in a more effective way. The reward that they've experienced in their marriage and in their relationship really warms my heart. And I think that's true for many individuals. But I think it starts with really committing and jumping into your session and really committing to the process, I would say, as a patient from their perspective.
Melanie, do you want to do another one, or do you want me to ask one? It's up to you. I know this is our first. You muted.
There we go. So Carlett, I'm quite interested in knowing, so obviously audiology is super broad, and we have so many different things going on, But what is your favorite part about it? I mean, you get those audios that never want to do a hearing test ever again in their lives and love doing Vestib. And what is your, like, what makes you happy? If you have a diary full of that, what is it that makes you happy?
Also something valid to note that it is such a broad field, and I think it's been a learning curve for me to learn that about myself and figure out what I really do enjoy and where I can help best, where am I also applying myself as a professional in the best way. And if I can narrow it down, I love my parents' age population. So sorry to everyone who falls out of the range of, between 60 and 75 years old. I just find it so fun to work with this population because there's a clear and healthy understanding of technology and how it can help them. And so when fitting them with hearing aids and exploring, all the features and everything it can do for them, it's almost like the reward that they gain from that is far greater than some other populations might with the exact same technology. So in terms of the field of audiology, I still think it's diagnostics and hearing aid fittings that are rewarding to me right now. And we don't really offer many of the other fields like vestibular assessments where we do it in office. So we are able to sort of focus and zone in exactly on that. So that's what's been really fun for me. So we'll see how long that lasts. But so far, so good.
I must say, it is a very, very nice population to work with, and I couldn't agree with you more. It's very, very rewarding, and just to connect your phone to your hearing aids and have hands-free calling is for some people as like a winner just on its own. So I can fully agree with you on that. I find also, so I've recently read the book The Pumpkin Plan. I don't know if you've read it or if you're planning on reading it, but it's a fabulous book. It's all about the farmers, the pumpkin farmers in America, and how they treat their crop. And one thing that came out from that is that the person that wrote it, the author, is talking about how we connect with other people on their values, more than necessarily an interpersonal relationship, but more than that is that if my values are the same as your values as a doctor that's seeing me or as an audiologist that's seeing me, then I connect really well to that doctor or audiologist or purchase person that's helping me. Could you tell me what maybe one or two of your values are within yourself and within your practice that you really hold true to yourself, that someone else that might be watching this might think, oh, I resonate really well with Carlett?
Yes, so it is important, I think, especially in such a personal journey that you walk with someone, that your values do align, at least to some degree. Often having different values can also pose an interesting, dynamic, because that allows you to sort of explore things about yourself that you might not have before. But anyway, so core values for me, I think, is definitely integrity, which really links in with honesty. I think for me, having all the options available for someone and honestly and truthfully being able to give them solutions, knowing that I'm not hiding behind any, um, incentive from my side, is really important to me. And I think patients and people who walk through our doors pick up on that. So someone who is solely there for maybe the best price or the best deal might not, prefer our services over someone who really wants to know that they are going to be placed at the center of it. So linking in with that, client-centered care is something we value. So honesty, integrity, and also just, I think, reliability to a degree. It's such a generic term, actually, but being a reliable professional is important for someone who decides to walk a journey with you that is long term. It's hardly ever that someone gets a hearing aid and will never need your assistance again. So I think for us, having a reliable track record, knowing where they can find us, knowing that there's clear channels of communication, having different ways of communicating and reaching us is important. And so far, I've been able to have an open channel directly to me, because we aren't a franchise or a multi-site practice yet. So I do have the time and the convenience to actually respond to my patients personally. So I find that very valuable. And that's something that I would have valued if I was looking for someone else out there.
I'm trying to figure out like a shortcut for how to unmute. On the I'm gonna kind of go on the thought about being reliable and that sort of thing. Obviously you as a professional often need to rely on others in your we have our circles. Who are you using within your circle as a professional to rely on to provide a better service to your patient, whether it be other specialists or if there's the services that you aren't able to necessarily provide for whatever reason? Who is it that you rely on as a professional?
Yeah, so a network is, pivotal and so important for any practice to really offer the best service. So in terms of other professionals that we work closely with, we have a handful of general practitioners in the area that often would refer, especially for middle ear problems and even wax removals, because they find that they don't have the time to spend, their time on that. So I'm not sure if I should be naming names, but I might as well. So Dr. Joe DeLonge is one of our favorites. He really is such a holistic healthcare provider, which we appreciate. So he always looks at the person as a whole. They often wouldn't go to him because they have a hearing or ear related issue, but he would make the appropriate referral. And of course, with things like balance disturbances and even severe cases of tinnitus, we do not really invest in those clients personally, because we feel that there are other experts in our area that can assist with that better. So another clinic, I believe they're also part of the network, is Experience Hearing at Wilgert. We refer our vestibular patients to them. They have a very good track record and a long-standing vestibular clinic. And of course, ENTs are an integral part of what we do. So the ear, nose and throat specialists in our area are mainly at Wilgert Hospital, so really close by, if you know Pretoria. Sorry if you don't, and other hospitals in the area as well. So I think a network of different professionals is also important, and even occupational therapists when it's a more of a sensory problem, so perhaps some sensory integration, or if there's developmental problems when it's in the younger population. So yeah, it's been interesting building those bonds and connections as well, and also having your values align with those professionals. So I don't think it's easy for someone else to also trust you, and vice versa. So we've tested the waters with each other, and so far we really enjoy the people that we work with at this point.
It's amazing. I think it's so great that you're able to share just your other professionals that you work with, and also to lean on other audiologists for different tests that you don't necessarily focus on. So that's amazing that you've got that network and support. So if you are between the ages of 60 and 75 and you live in Pretoria East, I thoroughly recommend that you go and see Carlett, who is going to be passionate about working with your ears and helping you to regain that connectivity with all of your devices. She's really passionate about helping you in your age group. And we look forward to having many more podcasts where we can learn a little bit more from each other. And just wanted to say thank you again for being here today. And for those people that are following, please like and subscribe to the videos and to the channel where you can meet more of our audiologists in the network. And again, if you're in Pretoria East and you're looking for an awesome independent clinical audiologist, please have a look out for Carlett. Thank you so much for having both of you on our podcast for today.
Thank you.